Welcome to Group 4's presentation on the market strategy evaluation for the Smart One Spirometer. My name is Mary and I'm joined by my teammates Kyle, Marissa, Jose, Saad, and John. Our analysis is broken down into the following 8 sections. Starting with the company background, MIR is a global company that specializes in medtech solutions. They've been in business for 30 years with a presence in over 100 countries. Their latest technology focuses on smart-enabled medical devices. Spirometers generally measure lung function. A notable difference between these two devices is in their size and function. The traditional device shown on the left has basic features and the data is usually printed or downloaded. The Smart One device shown on the right offers greater convenience and advanced features. It is handheld and wireless and allows data transfer to smartphones or cloud-based platforms, enabling remote and real-time monitoring.
I will now go over the spirometer industry analysis. Pulmonary function testing, or PFT, is the primary mechanism for the detection and monitoring of chronic obstructive pulmonary disorder, or COPD, as well as many other lung-related maladies. Specifically for COPD, a spirometer is primarily used to measure lung volume and capacity, airflow rate, and gas exchange via a non-invasive device. These devices can be categorized into 3 types: basic incentive or non-electric spirometers, digital peak flow meters, and digital smart spirometers, which will be the focus of this presentation. As a principal management tool for the treatment and maintenance of COPD, the market size in the United States can be calculated using a top-down approach. Given a U.S. population of 15 million individuals diagnosed with COPD, according to the 2020 census, this presents a $2.5 billion service addressable market, where 40% of these individuals are over the age of 65 and qualify for Medicare coverage for their care. This is a growing market due to several factors: a rising incidence of COPD combined with an aging population, increased reliance by hospitals on the early detection and treatment of chronic diseases, and the introduction of single patient use disposable accessories, such as spirometer mouthpieces, to avoid cross-contamination in a single household.
Hello, I am Jose Barrios. When considering the performance of MIR, it is important to discuss not only metrics, but it's important to discuss how those metrics assist with management decisions. In other words, we need to delineate what the key performance indicators or KPIs are. Simultaneously, we need to align the KPIs with MIR's mission or value propositions. MIR believes in smart health, and to that end, they are helping to facilitate more comprehensive personal health monitoring. The 3 KPIs. 1. Deterring medical noncompliance. This is achieved by streamlining the use of the remote spirometers and providing software that is compatible with Android, iOS, Windows, and Mac. 2. Decreasing contamination risk. This is achieved by providing consumables at low cost. The Smart One utilizes a disposable mouthpiece and a disposable turbine. 3. Maintaining HIPAA compliance. When addressing this, privacy is underscored since our personal health information is involved. Peer-to-peer connection and patient connection to their clinician is secure and protected by end-to-end encryption.
We recommend that MIR develop a 4-pillar market entry strategy. The first target market will include US-based COPD patients 65 years and older and prescribing physicians at large healthcare systems. MIR will develop a multi-channel sales and marketing plan, which I'll delve further into. Creating a key stakeholder map and formalizing partnerships will help MIR reach new customers, mobilize operationally, and react quickly to any early failures. This is a team sport, much like football, so MIR will need to activate a launch team comprised of internal and external experts that manage their own position. Taking a 360 approach, MIR should develop sales enablement materials to attract new customers, along with training guides to aid the implementation process post-sale. The Phase 1 launch will include campaigns across LinkedIn, email, and paid search, as well as regional sales efforts at industry events and hospitals. MIR should continuously collect data such as sales funnel information and what we like to call vanity metrics to refine the strategy. MIR will also want to identify satisfied customers to help tell their story to others, also known as brand ambassadors.
MIR
SmartOne spirometer challenges to expansion is divided into three factors: patients, providers, and cost. From the patient side, they prefer symptom monitoring over peak flow measurements to detect worsening lung functions. Studies show that patients prefer using spirometers mostly during symptomatic periods. Also, compliance with spirometer use lags after the first month of use, falling to 50% by 6 months and 33% by 12 months by some studies. Providers are not completely sold on home spirometer devices because of discrepancy of results between home spirometer readings and true lung functions, along with patients' compliance and technical issues. Editorials in prestigious medical journals like Thorax have questioned the usefulness of home spirometer monitoring of lung functions in improving management of conditions like asthma. Cost-wise, even though SmartOne is approved by CMS as a durable medical equipment item, the billing code is not yet available. This highlights that reimbursement pathways for digital home monitoring devices are still in their infancy. SmartOne spirometer currently retails for $130 in US, which makes it dependent on each patient's willingness to pay parameter.
To expand their global presence, we recommend pursuing emerging markets. They should continue to seek strategic partnerships with healthcare and research and collaborate with patient advocacy groups to increase awareness. It's also important to continue improving their products to stay ahead of the competition.
Due to the anticipated global market share increase for patient monitoring devices, the company will have to continue to research and develop their products in order to become more user-friendly for the years to come. The company will need to ensure continued success by exploring innovative advertising, which will primarily focus on our target group, which consists mainly from older patients. And this is imperative to make sure that we promote the product and services in a way that is best suited for the patients. Finally, the company will need to make sure that it negotiates contracts and agreements with insurance companies so that they can make accessible the product to a bigger audience for the healthcare industry.